Welcome everyone, and thanks for joining us today. My name is Natalie Justice, and I will be talking with you today about some sleep hygiene tips during this time, but really these are appropriate for all of the time. And just so you know, as you guys are coming in, your mic is muted upon entering this session. And if you have questions, we will have 10 to 15 minutes after the presentation for questions, and you can hover at the bottom of your screen to locate the chat feature. Please use the chat feature to type your questions. This presentation will last about 20 minutes or so, and then again, we'll have about 10 to 15 minutes at the end of the presentation for questions. And just so you know, this session will be recorded and it will be updated and posted at a later date to the TKOC Facebook page and the DDBP website. So we will go ahead and get started. So just some background, as you guys know, children with developmental disabilities are more likely to experience sleep problems, with reported rates of poor sleep ranging from 24 to 86%. So sleep problems are more common in this population, and that range is so large just because of the variability in people's definitions of what sleep problems are and in sampling variability. But it's just important to keep in mind that sleep problems are common with this population. So if you're experiencing difficulty with your family, it's not uncommon. Difficulty with sleep may include some of the following, such as falling asleep at bedtime or staying asleep, frequent or prolonged night awakenings, or irregular sleep and wake patterns where those shift and fluctuate frequently, or even a short sleep duration. So what causes sleep difficulty? Unfortunately, researchers are unsure why sleep difficulties are so prevalent in individuals with developmental disabilities. However, the best practice is to first rule out medical complexities with sleep. So please keep this in mind as we move forward. Today's presentation is going to focus on behavioral components that may also be playing a role with sleep complexities. So even though your child may have some medical concerns that impact their sleep, it's likely that if you include some behavior modification strategies, this could also help. I also want you to keep in mind that sleep patterns may change over time. So if you think about yourself and other members of your family, these patterns can change over time due to a variety of factors, including age, diet, medications, activity level throughout the day, some of those medical diagnoses that may impact sleep, as well as mental health difficulties such as anxiety or depression, as well as a change in environment or living situations, such as if you just moved, or let's say if you just switched from your child to sleeping in your bedroom to sleeping in their bedroom on their own. And I'm sure you can think of many other examples, but just keep in mind that these patterns may change or fluctuate over time, especially given the circumstances right now, you might be seeing a change as well. So how can you help? This is what we're going to talk about for the rest of the presentation. And it's important to establish good sleep hygiene for your children and for yourself. So what is sleep hygiene? This is a behavioral and environmental practice intended to create and maintain healthy sleep habits and routines. So let's break that down briefly. A behavioral and environmental practice means that you're going to use behavioral strategies and consider the environment that your child is exposed to when they're going to sleep. You're intended to create and maintain these strategies because once you have an appropriate routine established, you want to maintain that over time to help promote those healthy sleep habits and routine, because sleep is meant to be a routine. And we'll talk more about these specific strategies moving forward. So I'm going to go through some strategies today, and some of these you may already use. However, if you are using some of these, it might be appropriate that you modify or adjust these during this time because things might be a little bit different at home. So our first step when we think about good sleep hygiene is considering the sleep environment. So the question that I want you to ask yourself is, how can I adapt or change the environment for my child to make sure that they're as comfortable as possible or as relaxed as possible? So some examples include things like lighting, noise, temperature, and you know your child best, so I want you to consider their sensory sensitivities. Does your child prefer a lightweight blanket or a heavier blanket? A nightlight or complete darkness? Is it better that your child has complete silence or some background noise such as a fan? And you may also have that kiddo that likes to have a drink of water before bed or just have that cup nearby just in case they get thirsty in the middle of the night. Again, the big component here is you want to create a relaxing environment. So really consider what your child responds well to and try to make sure that this environment is as comfortable as possible and as consistent as possible every night. This leads us into our bedtime routine. This is extremely important that you consider these three components to the bedtime routine. It should be brief, predictable, and relaxing. So what brief means is typically aim for a 20 to 30-minute bedtime routine. This routine should be consistent every day of the week, even on the weekends, which would mean that it's going to become predictable for your child, so it really does become like a habit. That makes it a little bit easier as you move forward. And it should be relaxing. So you can consider certain activities if your kiddo is used to reading a bedtime story or listening to some quiet music, that's absolutely appropriate, or maybe doing some muscle relaxation with your older kiddos. So I really want you to hit home with those 3 points, keeping it brief, predictable, and relaxing. And a good point here is to definitely avoid use of electronics before bedtime because this is a stimulating activity rather than a relaxing activity. So you would certainly want to create a rule for your family such as 1 hour prior to bedtime, we put away the electronics. We're not playing video games anymore or listening to loud music or on our tablets. Another important note is that a lot of our kiddos respond really well to visuals. So this is an example of a visual schedule that could be used before bedtime. This is absolutely customizable for your family. Just think about, okay, what cue does my kiddo need to really remember our bedtime schedule and to focus in on, okay, this is what we do every night before we go to bed. It could be these pictures that are listed, such as dinner, bath, pajamas, brush teeth, story, and bedtime. On our next slide, I have another example. This includes pajamas, use the toilet, wash hands, brush teeth, drink water, read a story, go to bed, go to sleep. So I would just encourage you to think through, again, what pictures or cues would your child need to remember this routine? And in a couple slides, we will go through just a couple examples of checklists that might be more appropriate for our older teenagers. So in addition to the sleep environment and the routine, a couple other important notes are to keep to a consistent sleep and wake schedule. So what this means is you want to make sure that your child is going to sleep around the same time every night and waking up around the same time every day. I know this is easier said than done, but it's important to consistently follow this schedule throughout the week and on the weekends to keep to that routine so it becomes a routine for your child. In addition to that, you could consider some daytime exercise and physical activity. So it's been shown that kiddos that exert more activity during the day may have a deeper sleep during the night. So I would just caution you to not engage in this activity before bedtime. Instead, do this in the morning, in the afternoon, or during the day. Some additional steps to good sleep hygiene include avoiding caffeine. So this includes some chocolates, soda and pop, tea, or coffee. And this is up to you whether or not you avoid this completely and don't include it at all in your child's diet, or if it's something that your child may be able to engage in or consume earlier in the day, but certainly not later in the day. You would also want to avoid or limit naps. So typically naps are okay in preschool, but should definitely not be happening later in the afternoon and should be eliminated as your children get older. Also consider, we talked about this, but limiting TV, video games, other exciting activities or electronics at least 1 hour prior to bedtime. I included a note about co-sleeping because this often comes up. So co-sleeping is not uncommon and it absolutely depends on your family's culture. If you are co-sleeping and you're okay with it, then that's completely fine. You don't need to change anything. However, if co-sleeping is not necessarily in line with your family's values, working toward your child sleeping alone can support good sleep hygiene because this will help your child to fall back asleep alone if they have frequent night wakenings. So the way to think of it is if your child is pretty used to you helping them fall asleep, and then they wake up in the middle of the night, he or she might need your help every time to go back to sleep. So that's the reason why some researchers say that co-sleeping could be worked over time for your child to sleep alone, could help support good sleep hygiene. But I do want to note here that given the current circumstances, this may not be something that your family creates a goal to accomplish. If you are working on decreasing co-sleeping, it's absolutely okay that it takes time because it's a long process. And if it's something that you're working on right now, I would just encourage you, if your child does wake up in the middle of the night and seeks you for comfort, just put them right back to bed as quickly as possible. Keep it prompt and really boring, and don't engage in a lot of activities or conversation or lengthen that time. It should just be a quick, let's go back to sleep. All right, another note about our older sleepers or our teenagers. The strategies that we've talked about so far are absolutely appropriate for all ages, even for adults. I know we've talked a little bit already about screen time. I understand that during this time, it might be more common that our kiddos are using screens, particularly before bed. So I think the reason why you want to create this goal of turning off all screens 1 hour prior to bedtime is, again, because this is a stimulating activity. We want to create a relaxing environment before bedtime so that your child starts to calm down and understand that now is the time to get ready for bed and get sleepy. The other point for teenagers is if we set this rule of 1 hour prior to bedtime, we're turning off our screens and we stick to it, this really eliminates that room for negotiation because we can imagine our teenagers saying, okay, what about 5 more minutes? What about 10 more minutes? And then it's really pushing into your bedtime routine and everyone's going to bed a little later than planned. So rule of thumb, just set the rule 1 hour prior to bedtime. All electronics are done. In addition to that, you can consider using a checklist or reward system for your older sleepers. So with a checklist, the idea would be, what can you include in this checklist to help your child remember what they should do before bedtime to help them stay on task, but also be a little more independent? And you could consider a very simple reward system to boost their motivation, such as you include 3 points like brush teeth, put on pajamas, set out my clothes for tomorrow. And if every night they do those 3 things, maybe in the morning when they wake up, they could earn a special treat with breakfast or some extra TV time, for example, just to help boost their motivation a little bit. Another quick point about our older sleepers is that they may be going through puberty, and during this time, it might be that your teenager needs the same amount of sleep, or it might mean that they need a little bit more sleep. And if you notice that your teenager is going to sleep later and later every night and waking up later and later every morning, and if this isn't okay for your family, then what you can do is consider waking your child up a little bit earlier every day so that over time they go to sleep a little bit earlier every night. And again, this is something that really just depends on your family's goals, and it's okay if it takes some time. This is an example of a bedtime routine checklist that's meant for older sleepers. It's pretty simple. You can absolutely customize it based on what your kid is used to and what they need a reminder to do. And then if you'll see, there are 2 activities included. One is listen to quiet music for 10 minutes. The other is do a puzzle for 10 minutes. This, of course, does not have to be included, but if your teenager, for example, is used to doing something like this, or something else such as listening to a favorite story or reading a favorite book or drawing a picture, you could certainly include these during this checklist. Here's another example of a simple checklist. Put on pajamas, pick out tomorrow's clothes, brush teeth, wash face, read a book, give a kiss goodnight. If you wanted to simplify this and include a simple reward system, you could choose 3, for example. Maybe it's put on pajamas, pick out tomorrow's clothes, and brush your teeth. And if every night your child does these and checks them off, then in the morning they could get a little reward from you, just to help boost their motivation. And the idea here, again, is to help keep your child on task, help build their independence, and help them monitor things. So when you think of our younger kiddos, we have those pictures in place, whereas with our older kiddos, we might use something more like a checklist. Either or are okay, and it just really depends on your kid. And I think you guys know your kiddos best, so you could decide what might be appropriate for your family. And there are a lot of examples out there on the internet. I would definitely look to those for inspiration, but certainly do create your own so you can customize it for your family. So before we jump into some Q&A, I know I went through that really quickly. I want to put in here a special note for all of you that are working really hard right now. Your sleep matters too. So when you think of suggestions for adults, they're not that much different than what we suggest for our children. So consider setting a routine for yourself as well, because again, the likelihood of you getting really great sleep if your child is not getting really great sleep is probably pretty low. So some things you can think about for yourself is to maintain a routine, exercise and have a balanced diet, limit alcohol use and news intake, because as important as the news is, it can be anxiety provoking when we read it all the time. It is also appropriate for adults to avoid screen time before bed because it's stimulating and it keeps us up. And then if you're anything like me and you have those nighttime anxieties that keep you up before you fall asleep, it helps to make a to-do list to kind of put those aside and think about those things tomorrow. So I included some references, and if you all are able to, some good places to look for more information would be Autism Speaks, Autism Intervention Research Network on physical health, and the American Academy of Pediatrics has a great website called healthychildren.org. If you go to their website, healthychildren.org, and hover over their healthy living section, there's a sleep section for parents, and they have really great articles for parents on topics such as building a good routine, thinking about how many hours a night your child should sleep, and considering things like your mental health and your family culture when you're setting goals for sleep. So those are 3 really great resources I would encourage you all to look into. And again, this has been recorded, so whenever this presentation is uploaded to the TKOC Facebook page or the DDBP website, you should be able to access these links, but you can certainly Google them yourselves and look up these resources. So before you're finished, we do ask that you complete a session survey. Also, we will take about 10 to 15 minutes for questions. So at this time, you can take a minute to think through some thoughts or questions you may have. And if you hover at the bottom of your screen, you'll find the chat feature, which is where you can type your questions. As you guys are getting ready for that, I do want to remind you that future outreach events can be found on the DDBP outreach calendar. If you go to the Cincinnati Children's DDBP website, there's an event calendar at the bottom of the screen. Also, you can email DDBP Family Support at cchmc.org if you have any specific questions or if you're looking for some more specific resources. And one other quick note, behavioral and sleep consults are available for existing patients. So families can call 513-636-4611 and ask to speak with their DDBP medical provider or psychologist to learn more, and that's for existing patients. So again, we do have some time for Q&A, and I will be able to pull up the chat feature if anyone has questions. As you guys are thinking through that, I would also encourage you to look into the American Academy of Pediatrics. There's a journal on sleep medicine that does outline some tips in terms of how many hours per night children should be sleeping. I think if we're thinking through infants, it's typically 12 to 16 hours per 24-hour period. If we're thinking of children 1 to 2 years of age, that should be around 11 to 14 hours. Children 3 to 5 should be 10 to 13 hours. Children 6 to 12 should be 9 to 12 hours. And then teenagers 13 through 18 is typically around that 8 to 10 hour period, similar to adults. So I'll wait a couple minutes to see if anyone has any questions, but I will go back to our references slide. I do want to point out that the first two references are really great parent guides for improving sleep. The first is for children with autism, and the second is for teenagers with autism. And again, these are through the Autism Speaks and Autism Intervention Research on physical health. So both of these are parents' guides that are, I think, no more than 10 pages, and they break down everything that I discussed today and give you some more visuals and examples for support. And then finally, that final reference is through the American Academy of Pediatrics, which has some really great resources for parents on sleep for kiddos with developmental disabilities of all ages. We do have a question about any suggestions for kiddos that share rooms, such as one that may wake up frequently throughout the night and disturb the sibling. That's a really tough one, and I think that this might depend on your family culture and the age of the siblings that are sleeping or co-sleeping in the same bedroom. I think what would be helpful is to consider each of your kiddos' individual differences and think through what kind of schedule can we have each kiddo on. And then also consider how can we combine that schedule and make it appropriate for both of them. And if we're having a kiddo that's waking the other kiddo up frequently, how can we eliminate that in any way? Is it that we try to get them on the same schedule and same routine? Or is it that we try to maybe consider some other factors like bringing in some background noise like a fan or something like that to maybe help keep the kiddos a little bit more soothed at night, so maybe the other one doesn't wake up as easily. I know that's tough.
How many hours, is it okay to get your, is it okay to get your kids milk before they go to bed?
That's a great question. So I think it's generally suggested to limit liquids before bedtime. However, this definitely depends for each child. So for example, some kiddos might need liquids limited, let's say an hour prior to bedtime, whereas others it may only be a half hour. So I think milk is okay before bedtime, certainly. I would just consider, one, how much should you limit before they go to bed, while also making sure they use the bathroom before they go to bed. And then two, think through how many liquids that they've had throughout the day. Have they had a lot to drink all day long? If so, that's where I would definitely encourage fewer liquids before bedtime and spacing that out a little bit. That's a great question. Thank you. Meg also gave us a suggestion, thinking back to if you have siblings that are sharing a room and if they're waking each other up, you could also consider a small reward chart for your kiddo that tends to be the one that wakes up often. And this could be something really simple like a sticker system or a star chart, just to help encourage them to not wake up their siblings. That's a great idea. So we have a few more minutes, and if anyone has any additional questions, please feel free to enter them into the chat box. I hope that this was helpful. And again, this was recorded and you can access it later through the TKOC Facebook page or the DDBP website. And again, there will be a session survey. We would love your feedback.
How many hours does a kid need to sleep? Your child.
Okay, so I can go through this reference. Again, this is through the American Academy of Sleep Medicine, through the Journal of Clinical Sleep Medicine. So I'll break it down by age. If you have infants that are 4 months to 12 months, this may not be appropriate for anyone, but this is typical for infants where they would sleep 12 to 16 hours in a 24-hour period. However, moving up, if you're thinking of children that are 1 to 2 years of age, sleep is typically 11 to 14 hours a night. Children 3 to 5 years of age, this is typically 10 to 13 hours. Children 6 to 12 years of age, this is typically 9 to 12 hours. And then teenagers 13 to 18 years is typically 8 to 10 hours, which is about same for us adults.
How about like 5-year-old? How many hours?
Around a 5-year-old, I mean, I think there's a general suggestion of around 10 hours, but that's okay if it fluctuates. It might be less than 10 or more than 10.
All right, thank you.
You're welcome. I have a great question about naps. So do these hours that we just reviewed, do these include naps? These do include naps. And again, that's through the Journal of Sleep Medicine. So if you consider those younger kiddos, that would include nap time, but the older kiddos, such as 5, 6, 7 and up, when you start to wean out those naps, then those hours wouldn't include naps anymore. We also have a question. My daughter always insists she's hungry right before she goes to sleep. I know she's doing this to try to stay awake. Should I continue to give her a snack? This is tough. If you're absolutely certain that she's doing this to try to stay awake, then I would try not to give the snack. Instead, I would think through your bedtime routine. If it's the case that you're getting ready for bed hours after you've had dinner, you might consider before you start your bedtime routine to have a snack. And then that way, once you start to actually get ready for bed within that 30-minute window, where let's say you do your bath time, brush your teeth, use the bathroom, put on pajamas, read a story, during that time, I would refrain from the snack. And again, you could just do it before. It's a great question. Hey, does anyone have any lingering questions before we leave our meeting?
Do you have one for tomorrow too?
I don't believe we have one tomorrow. I believe our next one is coming up on Wednesday.
Wednesday? Okay.
Wednesday at noon, there'll be one on collaborating with your school system during homebound instruction.
Okay. All right.
All of the flyers for our upcoming virtual series are posted on the Kelly O'Leary Center Facebook page as well.
Okay, well, everyone, we are all finished. So remember that you can access these at a later date on the TKOC Facebook page or the DDBP website. There will be a session survey, so please complete that. We would really appreciate your feedback. And again, you can always email our DDBP family support at cchmc.org if you would have any additional questions or like additional resources. So thanks so much for joining us today, everyone.